Welcome back to the news at 10. The leadership tussle between the two nominees by the federal government to serve as the Director General of the National Productivity Center is yet to be laid to rest, as both candidates continue to claim leadership of the agency. Whereas Dr. Faith Robert, a lecturer at the Niger Delta University in Bayelsa State, claims his appointment was signed by the former Secretary to the state government, Pius Ayim. The other candidate, Mr. Kashim Akko, also has his offer letter signed by the former Minister of Labour, Joel Danlami Ikenya. Both nominees say their appointments were approved by the former President, Dr. Goodluck Jonathan.
Dr. Faith Robert and Kashim Akko are two nominees with letters of appointment as Directors General of the National Productivity Center, an agency of the Federal Ministry of Labour. Dr. Faith claims his appointment as Director General of the agency was signed by the former Secretary to the Government of the Federation.
My appointment letter was signed by the Secretary to the Federal Government, which, to my reckoning, is the duly constituted authority to issue a political appointment that has been approved by the President. So my letter was signed by the Secretary to the Federal Government, Pius Ayim.
For Mr. Kashim, apart from his appointment letter, he also has a duly signed letter from the Permanent Secretary, Ministry of Labour, acknowledging him as the Director General of the agency.
This is a letter he has just given me. I think this letter speaks for itself. If I think it would be proper for you to see, this is a letter from the Permanent Secretary, Federal Ministry of Labour and Productivity. It's a public notice. And this letter speaks for itself. It tests all.
Although both candidates claim to be in charge of the agency, only Mr. Kashim appears to currently have access to the office, as Dr. Faith was denied access to the office the day he wanted to resume.
Security locked.
When Channels Television tried to probe further from the two contestants what the whole issue was, this was what we got.
If any such matters happened, the authorities in the ministry will have had the courtesy to inform me if it was if somebody else had been duly appointed legally, to take over my position. I will have been appropriately communicated to officially.
As you can see, I'm on my seat, attending to the duties of the job of the Director General. So, but for more clarification and whatever, to clear doubt, he's in the best position to address that. But all I can tell you now is that there is a public notice issued by the Permanent Secretary today, 15th of June. So that's a copy there.
The Permanent Secretary, Ministry of Labour, who refused to appear on camera, told Channels Television via a telephone conversation that he has issued a public notice confirming the appointment of Mr. Kashim as the new Director General of the agency. Neither the Secretary to the Government of the Federation nor the Minister is in office to clear the confusion. But this could just be one issue waiting for whoever becomes the new Labour Minister or new Secretary to the Government of the Federation to address.
As the world remembers the agony of many battling with sickle cell anemia, the Ministry of Health has revealed that over 40 million Nigerians are faced with the condition. In this next report, we examine the experience of sufferers, caregivers, and what medical professionals are saying about the disease.
Nigeria bears a huge burden of sickle cell anemia, as about 130,000 children are born annually with sickle cell, with some dying before the age of 5. According to the Ministry of Health, over 40 million Nigerians live with this disease.
Mortalities arising from complications of sickle cell disease occur mostly in children under 5, adolescents and pregnant women. It is also estimated that over 40 million Nigerians have the sickle cell trait.
Both the sufferers of sickle cell anemia and their caregivers experience severe difficulties managing the disorder.
My first crisis was at age 10. I had a major, and it took me. I was rushed into the hospital on the 18th of March, and was out on the 6th of August. My parents were surprised. I lost a sister. Our firstborn was also sickle cell, a sickler, and so we lost her to sickle cell. And when I had mine at age 10, it was I was almost crippled.
It's been a long day for us. Our son was presented with what appeared to be malaria. And we were in South Africa. We said, treat him for malaria. And then it snowballed into so many other complications. It was bedfast for about 18 months.
Apart from the pains associated with the disease, sufferers say the disorder also affects other aspects of their lives.
The stigmatization has been there. It still is there. It has affected my relationships. I go into relationships. I know the right thing to do is to tell the guy that, look, this is my condition. So if you're in for the long haul, this is what it is. But because of that fear, I'm withdrawn. I hold back because I don't want to lose the guy, you know. But to God be the glory. I mean, when the right guy comes, we would walk down the aisle.
Although stem cell transplant is currently one way of treating this disorder, experts say early diagnosis can be helpful.
Sickle cell disease is a chronic lifelong disease, and the earlier you make the diagnosis, the better. And that's why newborn screening or early infancy screening is so vitally important.
Sickle cell anemia is an inherited red blood cell disorder. Those who suffer this disorder are said to have abnormal hemoglobin in their red blood cells.
A viral respiratory condition is brewing concern in the global health world, with a total of 166 confirmed cases of the disease. According to the World Health Organization, as of June 20, the Republic of Korea accounts for 165 of these cases and one in China, with death toll currently at 24. On our Focus on Health tonight, our correspondent Yomi Otaigbe reports that although no case of the Middle East respiratory syndrome coronavirus has been reported in Nigeria, everyone needs to know more about the mode of transmission and prevention for the disease because the world is a global village.
It may not be a major headline news now, but the Middle East respiratory syndrome novel coronavirus is a condition that individuals and governments need to understand and nip in the bud before it becomes a public health emergency of international concern. The Middle East respiratory syndrome coronavirus was first identified in Saudi Arabia in 2012, with early research suggesting a link between the virus, bats and camels. In about 3 years, confirmed and unconfirmed cases have so far been reported in over 20 countries. A public health physician with the Department of Community Health at the Lagos University Teaching Hospital gives further insight into this virus.
Coronaviruses are usually a group of viruses that cause most times mild to moderate respiratory infections, but somehow these MERS and the sister SARS that we knew before can tend to cause very severe illnesses, and patients usually will have symptoms of fever, cough, and for most people will present this way, and when they get complicated, they tend to have pneumonia and even result to kidney failure. About 3 to 4 persons out of 10 who get infected with this virus could die.
Avoiding deaths from the virus involves knowing the transmission routes, preventing the infection from occurring in the first place, and controlling its spread.
Like most respiratory illnesses, people get infected by the respiratory discharges as saliva of infected patients. So that's how people can get it. That's one. Then secondly is from contact. When somebody comes down is exposed to the virus right now, you have contact with friends, families, and people around you. Then thirdly, too, when they probably go to seek health care, you know, and close contact with, if the health facility is not optimally complying to standard infection prevention control measures, it can be transmitted that way too.
Just like the time of Ebola, what's important for everybody to know is to have a high index of suspicion, especially for people who have traveled to those areas, and in addition, those who work within the healthcare sector, like doctors, nurses, and any other person who has had contact with the health facility, to have a high index of suspicion. Because essentially what you're looking at is that if anyone has come in contact with someone who has contracted the virus, essentially within a period of, we know that within a period of 2 to 14 days, those who will have the illness typically develop within that period, but for most people between 5 to 6 days.
Although there is no reported nor confirmed case of the disease in Nigeria, how much knowledge of the Middle East respiratory syndrome coronavirus is in the public space?
No knowledge yet. I've never had such a thing.
For a virus that has no vaccine and can be easily transported from one location to another, everybody needs to be aware and take precautionary measures.
For the Middle East respiratory syndrome, what we know is that right now we don't have any specific treatment for the condition. But what we know is that with supportive treatment, in the sense that if, for example, the person is having a kidney failure, you offer supportive treatment and whatever treatment is appropriate for that condition. But more importantly, what we need to emphasize is the prevention and control of the disease. And for individuals at home, it's just like the condition, during the time of Ebola, the same set of measures that we emphasized are still the things that are important in this time. And what are we talking about? Number one, you need to wash your hand as often as possible. Wash your hand with soap and water for at least 20 seconds and as frequently as possible. And also help your children to do the same and teach them to do the same, and every other person. And for those who are ill, to a large extent, you want to avoid having such intimate contact with those who are sick. And then another thing that we also need to do is that when people are coughing, which is also part of the hygiene, that they need to learn to either cover the nose and the mouth with a tissue, or at best blow into the heel of, your elbow.
The understanding of the virus continues to evolve. It's not a time to panic or spread unfounded information, but a wake-up call in a highly mobile world that countries, including Nigeria, should be adequately prepared for unanticipated possibility of an outbreak. Yomi Otaigwe reporting for Channels Television News.
Efforts to actualize the industrialization plan of the Imo State government appears to be yielding results. The state government has opened discussion with the Chinese Consul General to Nigeria with a view to tapping into the experience of China in the development of the state. While receiving the Consul General, Mr. Liu Khan, at the Government House in Owerri, the Imo State capital, the Governor, Rochas Okorocha, expressed optimism that the visit will be a start of a robust relationship between Imo State and China.
The Consul General of the People's Republic of China, Mr. Liu Khan, is here at the Exco chambers of the Imo State Government House to meet the Governor and members of his cabinet. This is his first visit to the state, to initiate a partnership with the state government in the area of industrialization.
Imo State is a very developing state with abundant resources and with potential opportunities to do business. Our country would like to play a connecting bridge between China and the Imo States.
Governor Rochas Okorocha believes the partnership will help in creating jobs for the unemployed youth.
We want to succeed like the Chinese have succeeded in the industrial sector of the economy. And what we ask for is the technological know-how from their country. Because we have the human resources in abundance, we have the material resources in abundance. What we lack here is the technological know-how.
The governor also uses the opportunity to appeal to the government of China to revisit the case of Nigerians serving jail time in their country.
I'm concerned about the people, Nigerians, particularly the people from the Imo State, and I want to have a working relationship with you to revisit the cases of those Nigerians, especially those from the state, to know what are their offenses, to make sure no innocent Nigerian is punished for offense he or she has not committed.
Outside the chambers, some of the citizens expressed their feeling about the partnership with China.
What the government is doing is empowering the private sector, creating an enabling environment that will make people set up industries and set up business organizations that will eventually begin to employ our youths.
This renewed relationship between Imo State and China will be another contribution towards improving the economy of the state.
Hello, welcome to Business News. The Nigeria Liquefied Natural Gas Company has reaffirmed its commitment to construct the first major shipyard in Africa, which is expected to cost $1.5 billion. This is coming from the NLNG spokesman, Anthony Okonedo. Aligned with plans to make the country a hub for maritime operations on the continent, NLNG says Samsung Heavy Industries and Hyundai Heavy Industries have both agreed to a $30 million contract towards the project. According to Okonedo, the shipyard will be located in Badagry, Lagos, with a capacity to transport 2.5 million barrels of crude per day. The National Association of Securities Dealers Over-the-Counter has added one more company to its list. The latest admission is the shares of Funman Agricultural Product Industries, which brings the number of the equities on the OTC to 22. The NASD OTC is a key player in the Emerging Capital Markets Task Force of the UK Foreign and Commonwealth Office. It is saddled with the responsibility of delivering access to finance and developing the capital market with increased liquidity. A leading member of the Nigerian Stock Exchange, Andrew Saku, is asking investors waiting on the sidelines of government's economic policies to remain patient in their investment decision. He has advised investors not to fret over the state of the financial market, saying that securities performances at times like this can only depend on pronouncement from the government.
Government drives a lot of things, economy, politics, and what have you, and you can't take out one string out of the pack. What the government needs to do, which everybody is, consciously waiting for, is to see the policy direction of, the new administration. The fact that people are waiting on the sideline is largely because they're not totally sure what kind of policies might come. Is there going to be any participation as to what is on ground and how is that likely to impact on their business, performance going forward? But I think by and large, a vote for the current administration is a vote of confidence. It's a vote for change, like the mantra goes. And I think everybody should be, patient to an extent to await the pronouncements that will come forth.
The bears were more pronounced this week at the Nigerian equities market as broad sell-offs extended negative for a third consecutive week. Key indicators plunged 1.08% to an all-share index at 33,257.90. The market capitalization ended the week at 11.35 trillion naira. 28 gainers and 46 decliners played out in the price discovery game of the week. Cement Company of Northern Nigeria topped the chart with 1 naira 13 kobo appreciation, while RT Briscoe gained 25 kobo as Champion Bureaus closed upbit at 22 kobo. On the flip side, C&I Leasing took the lead, losing 10 kobo. Mayan Baker and Vinner Products took the second and third position, respectively. Access Bank, Zenith Bank and Guarantee Trust Bank gave equities trading the boost of the week as the financial services sector took the shine by almost 1 million units during the 5 sessions. In all, a total of 1.28 billion shares valued at 31.29 billion naira were exchanged in 19,143 deals. And that's it on Business News. I'm Anne Umawadu Harriet. We'll be back with the rest of the news at 10.
Thank you, Anne. When the news at 10 returns, Serbia wins first ever international title after a 2-1 triumph over Brazil in the final of the FIFA Under-20 World Cup in New Zealand. That's on Sports News. Please join us again.